Hey everyone, if you're on Medicare or turning 65 soon, I need you to pause whatever you're doing because what I'm about to tell you could save you thousands of dollars next year. Medicare's 2026 open enrollment period just started, and there are some major changes that most people don't even know about yet. I've been going through all the new plan options and policy updates so you don't have to wade through hundreds of pages of confusing Medicare documents. I'm here because I know healthcare costs are crushing so many of you, and you deserve to understand exactly what's changing with your Medicare coverage without getting lost in insurance company jargon. Whether you're a retiree trying to stretch your fixed income, someone managing multiple chronic conditions, or caring for an elderly parent, these changes affect your wallet and your health. So grab that coffee, settle in, and let's break down everything you need to know about Medicare changes that could impact your coverage and costs starting January 1 St. Let me start by explaining what's driving these changes because understanding the why helps you make better decisions. The Medicare Modernization Act updates for 2026 focus on three key areas, and each one matters for your healthcare and your budget. First, they're expanding prescription drug coverage under Medicare Part D. The notorious donut hole is getting smaller again, and there are new caps on out-of-pocket drug costs. If you're taking expensive medications, this could save you serious money. Second, they're introducing new Medicare Advantage plan options with enhanced benefits. We're talking about coverage for things like dental, vision, and hearing aids that traditional Medicare doesn't cover. Some plans are even covering gym memberships and meal delivery services. Third, and this is huge, they're changing how Medicare supplement insurance works with new standardized plans that offer better coverage for less money in many cases. Now let's talk about who needs to pay close attention because I want you to know if these changes directly affect you. If you're currently on Original Medicare with a Part D prescription plan, you need to review your drug coverage because the formularies and costs are changing significantly. For those on Medicare Advantage plans, your current plan might be discontinued or have major benefit changes. Even if your plan is staying the same, there might be new options that offer better value for your specific needs. If you have a Medicare supplement plan, especially plans F and C that are no longer available to new enrollees, there are new options that might give you better coverage for less money. Caregivers managing Medicare for elderly parents, these changes could mean significant cost savings, but you need to act during the enrollment period or you'll be stuck with current plans for another full year. Those of you turning 65 and entering Medicare for the first time, you have more options than ever, but that also means more complexity in choosing the right coverage. Alright, let's dive into what's actually changing, and I'm going to explain this in plain English because Medicare is complicated enough without insurance company marketing speak. Starting in 2026, the Part D prescription drug donut hole coverage gap is being reduced further. Once you hit the initial coverage limit, instead of paying 25% of drug costs, you'll pay only 15% until you reach catastrophic coverage. For someone taking expensive medications, this could mean savings of $200 to $800 per year. The out-of-pocket maximum for Part D is also dropping from $8,000 to $6,500. If you're taking multiple expensive medications, hitting that lower cap sooner means Medicare picks up more of your costs earlier in the year. For Medicare Advantage plans, the big news is expanded supplemental benefits. Many 2026 plans now include comprehensive dental coverage, not just basic cleanings. We're talking about coverage for crowns, bridges, and even some cosmetic procedures. Vision coverage is expanding beyond just eye exams to include designer frames and premium lens options. The most exciting addition is hearing aid coverage. Many Medicare Advantage plans will now cover hearing aids up to $3,000 per year. If you've been putting off getting hearing aids because of the cost, this could be a game changer. Medicare Supplement Insurance is introducing two new standardized plans. Plan G Plus offers everything that popular Plan G covers, plus adds prescription drug coverage so you don't need a separate Part D plan. Plan N Plus keeps the lower premiums of Plan N but reduces some of the co-pays and co-insurance you have to pay. Let's talk about the realistic benefits because I always want to give you the full picture. First, these prescription drug changes are retroactive for the first quarter of 2026. If you hit the donut hole in January or February, you'll get refunds for overpayments once the new system kicks in. Second, the Medicare Advantage special enrollment periods are expanding. If your plan significantly changes your drug formulary or provider network, you'll have a 60-day window to switch plans outside of the normal enrollment period. Third, Medicare is introducing new price transparency tools. You'll be able to compare actual costs for procedures and medications across different providers in your area, not just estimated costs. For those managing chronic conditions like diabetes, heart disease, or arthritis, many Medicare Advantage plans are adding specialized care management programs. These include dedicated nurse coordinators, home monitoring equipment, and even transportation to medical appointments. Let's talk timing because these changes have specific deadlines that you cannot miss. Medicare open enrollment runs from October 15th through December 7th. Whatever you choose takes effect January 1 SSI, 2026. The new Medicare supplement plans become available January 1 SSI, but you need to apply during your plan's open enrollment period to guarantee acceptance regardless of health conditions. If you're turning 65, your initial enrollment period gives you 7 months to sign up, starting 3 months before your 65th birthday. Miss this window, and you could face late enrollment penalties for life. Here's your action plan, and I want you to take notes because these steps could save you thousands. First, review your current prescription medications and costs. Use Medicare's Plan Finder tool to compare how your current drugs will be covered under different 2026 plans. Second, if you're on Medicare Advantage, check if your doctors and specialists are still in your plan's network for 2026. Networks change every year, and you don't want surprises when you need care. Third, calculate your total estimated costs, not just monthly premiums. A plan with a higher premium might save you money overall if it has better coverage for your specific needs. Fourth, if you're healthy and on a Medicare supplement plan, consider switching to one of the new plans during your state's open enrollment period. You might get better coverage for the same or lower cost. Fifth, don't ignore Medicare Advantage if you dismissed it before. The 2026 plans have significantly better benefits than previous years, especially for dental, vision, and prescription drugs. Now, let me address some challenges you might face. First, choice overload is real. With more options comes more complexity. Don't try to analyze every single plan. Focus on the 3 or 4 that best match your specific needs and budget. Second, insurance company marketing can be misleading. Those $0 premium Medicare Advantage ads don't tell you about higher copays, deductibles, or network restrictions that could cost you more in the long run. Third, if you have complicated health needs or take expensive medications, changing plans always carries some risk. Make sure any new plan covers your doctors and medications before you switch. Be extremely careful about Medicare scams during enrollment season. Legitimate Medicare representatives will never call you unsolicited or ask for your Medicare number over the phone. All official communications come through mail or through your secure Medicare.gov account. Here's what I want you to remember as we wrap up. Medicare open enrollment only happens once a year. The decisions you make now affect your healthcare and costs for the entire year. You can't change your mind in March when you realize your new plan doesn't work for you. These 2026 changes represent the biggest improvements to Medicare benefits in years, but only if you take action to review your options. Don't assume your current plan is still your best choice just because it worked last year. I'll be creating detailed videos about specific aspects of these changes over the next few weeks. Make sure you're subscribed and hit that notification bell so you don't miss my deep dives into Medicare Advantage comparisons, prescription drug plan analysis, and Medicare supplement shopping strategies. Check out last week's video about Medicare fraud protection, especially important during enrollment season. The link is in the description along with resources for free Medicare counseling in your area. Let me know in the comments what specific Medicare topics you'd like me to cover next. I read every comment and your questions often become my next videos. Remember, good healthcare shouldn't bankrupt you, and these Medicare changes are designed to give you better coverage for less money. Take advantage of them. I'll see you next time.